You're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out. Ooh.
Our stories are different, but we're all going through some bad times.
We gon' walk it out and woo.
We've never been in a shelter before, and you hear so much horror stories about shelters.
And I'll rise like the day, I'll rise up.
While I was here, I think I grew a lot because this center is very different from other shelters that I've been in.
The other shelters, they don't really help you as much as they do here.
People become homeless for a variety of reasons. It can be that they had a conflict with a family member that they were sharing a household with. Maybe they lost their job. They also can come because they got a divorce and unexpectedly had to carry their expenses on their own. Where do you go when you have nowhere else to go? And we're here to help.
We do not have a Department of Social Services in the city of Norwalk, so it's really critical that the Open Door Shelter is here and that we give it the support that they need.
Homelessness is a solvable problem, and I think in the past it's lost the sense of urgency. And what we see here today in Connecticut is that we are ending homelessness.
What we're going to do now is we're going to work to solve some of the issues that people have, do it in a collaborative way, do it in a way that has better results, and actually do it in a way that saves money.
And that's all part of a bigger picture, which is our goal of Zero 2016. And that means to end chronic homelessness by the end of this calendar year.
We work in partnership with landlords to match people to the right housing and then continue to make sure they're supported so they're successful in their housing.
A few things I got going. I got hit by a drunk driver. I ended up in the hospital. My whole finances just went real quick.
You meet with the case manager within the first 48 hours you are here in the shelter. And what we do an assessment because we want to find out what that person's strengths are.
We know that if you get them stabilized, that they are more able to address whatever other issues they might have.
So that could be job training, it could be connections to Social Security income, it could be help finding food sources so that they can pay their rent and not have to choose between food and rent. We house 95 people at night, but serve hundreds of people during the day.
It's an open kitchen. Everybody comes up, they get greeted every day, they get their whole meal. So we're talking about maybe 300 to 400 meals a day.
Serving breakfast, lunch, and dinner 7 days a week. We were close to 12,000 meals for the month.
In addition, we have a pantry grocery program Monday through Friday where people in the neighborhood can come here once every 3 weeks for a grocery bag.
The Open Door Shelter is more than food, shelter, and clothing. It's a solution.
Collaboration between Norwalk Hospital and the Norwalk Community Health Center and the Open Door Shelter established the need for a medical facility, a mobile medical facility.
Without the mobile unit, a lot of people from the shelter in this community would not have access to health care.
We bring the patient care to the patient. These patients don't have transportation. We provide care for chronic diseases like diabetes, high blood pressure, high cholesterol, but we also provide sick visits.
They might need mental health support. At the very least, people are depressed from being homeless. They may have more serious issues than that and need medication. Each of us are individuals, so it's important that we recognize that the plan that works for one person isn't going to be the same plan that works for everybody.
Not only the residents of the shelter, but members of the community in general would go to the emergency room for what would be routine medical care. That cost to the community, that cost to the hospital, that cost in terms of unnecessary services being provided for non-emergency service, it's significant.
We actually saw a 52% reduction in the number of people visiting the emergency room because we're able to provide health care here on site.
The Open Door Shelter is also a certified domestic violence center. And the fact that the shelter is open 24 hours a day, 7 days a week, means that at any time that someone has a crisis in the way of domestic violence, there will be someone here to help them.
One of the things that's important to us is making sure that we're ending the cycle of homelessness. And for a child to be homeless, it often sets a pattern for them to be homeless as an adult.
I go to school at nights from 6 to 10. It would be very hard for me to juggle school and trying to find somewhere to sleep at night with my children. And I'm here and I know they're okay.
I think there are a lot of people who aren't even aware that there are families with children living here.
We work with children from kindergarten through age 5 to 18. We individualize our entire program for the children. We really focus in on what each child needs and really try to develop a program for them. Going to college, having a profession, they will always have a way to support themselves. That will end the cycle of homelessness.
I often tell my children, we're on a journey and we're just passing through.
What's going on? How you doing?
I'm all right. There isn't anything else in the country that is actually doing the combination of housing, health clinic, and a jobs training program all in the same setting. But we know that all of those things, that they work and that they help get people back on their feet.
Communication about the services not only that the shelter currently provides, but communication about what the Sono Life Center will provide to the community is really very important.
If you think back 20, 30 years of a homeless shelter, it was very reactive. It didn't really help try and solve problems. The Sono Life Center really turns that completely around.
If we don't address the challenges of homelessness now, it's not going to go away. It's not going to go away on its own. And in fact, the challenges of homelessness, the longer we allow it to exist, will become greater and greater, and maybe someday beyond our ability to positively affect them.
All we need is hope, and for that we have each other.
You know, we all want the same things in life. We want a nice home for our family, a comfort home, a safe, secure home. And we need to help the young people and the families who find themselves struggling and help them find those kinds of things that we all enjoy and we take for granted.
Hope. Hope. That's the word. Hope. No matter where you are, there's hope.
Because without hope, you won't have the determination to keep going.
We're here to give a hand up, not just a handout.
I will rise 1,000 times again.
We are transforming the community. You can be part of it.